Although hypertension on its own may not cause cataract, an eye expert, Professor Charles Becker-Bell, has said that hypertensive patients may have a higher risk of developing cataract due to their medication. Professor Becker-Bell, in his inaugural lecture entitled "That the Eyes May See" at the University of Ibadan, said prolonged use of some antihypertensives may make users develop cataract. He stated that in a study carried out in Ibadan, diabetes, ultraviolet radiation, hypertension, steroid use and cigarette smoking among those studied were connected with cataract. The Don said that cataract is the commonest cause of blindness and visually loss globally and in Nigeria, adding that the eye problem is treatable by surgical operation. Also read President Buhari Shea Support Group, ONU, Okorocha in Leadership War, noting that the eyes are more than organs of sight. Becker-Bell said the organ can also be a source of much pain and suffering in many disease conditions which typically may affect the eyes. The Don, he remarked that the eye can also be a window to the body, declared, many conditions affecting the body have an effect on the eyes and may be their first point of observation. Of such diseases as diabetes, squint, glaucoma, cataract and diabetic or hypertensive retinopathy. He listed other diseases that affect the eye too include pterygium, glaucoma, eye injuries, low vision as well as tumors. The Don said that pterygium is a fleshy growth on the eye which, although rarely causes blindness, disfigures the white of the eyes. It is common in middle-aged men and women who spend a lot of time exposed to sunlight and harsh or extreme weather and dusty conditions. It is commonly found in farmers, fishermen, traders, sawmillers and motorcyclists, he added. He declared that the incidence of glaucoma, the second commonest cause of blindness in Nigeria, is also higher among blacks compared to whites. Professor Becker-Bell said those who have injuries from pressurized bottled drink may remain severely visually impaired or blind despite treatment because of the severity of the injury, associated complications and delay in instituting surgery in poor patients. The expert, however, called for increased funding for researchers, adding that most international grants available to university staff are donor-driven and with less regard for solving local problems.